Going to talk about typhoid. Yes, typhoid is one of the most infectious disease in the developing country like India, South Africa, and China. So I thought that I should make this video to aware you as usual. So typhoid is a disease in which we infected by a bacteria known as Salmonella typhi, and very similar disease to typhoid is paratyphoid. It is less severe than typhoid. It is due to the infection of the bacteria Salmonella paratyphi. Every year in India, more than 27 million people suffers from typhoid. So it is just like a hazard. So how will you find that you are suffering from typhoid? What will the symptoms? The symptoms is that if you are facing high fever above 40 degrees Celsius and the fever reaching up to 104 Fahrenheit, along with the problem of the gastrointestinal tract, like if you are facing the pain in lower abdominal region, if you are facing the nausea, vomiting, and maybe leads to diarrhea, sometime diarrhea, then you should consult your doctor. Typhoid is one of the most infectious disease because it is spread through the orophycal route, and if you drink contaminated water, the most of the people suffers from typhoid is due to the contaminated water, contaminated food, contaminated vegetables. And if you do not maintain your personal hygiene, if you find that if someone in your family, in your society is suffering from typhoid, then you should maintain the personal hygiene. And most of the antibiotic used to treat the typhoid is ciprofloxacin, Chloramphenicol, Ampicillin. Actually, the problem is that some of the strain of Salmonella is resistant against some of the antibiotics. So the doctor can prescribe you for culture, urine culture, to find which antibiotic is suitable for you. And doctor can also prescribe you for the examination of your stool. So this is not your business. Your business is only to prevent you maintain the personal hygiene. So now, how to stop typhoid? Typhoid is a problem of non-hygiene. This is spread due to non-hygiene. So if you maintain your personal hygiene, if you clean your society, if you do not drink the contaminated water, contaminated vegetable, if you wash your hand, if you eat the food before, if you use the vegetable after washing, then I think that the risk will be low. Now, some of the questions come through the patient that if you have done your test after just 15 days after typhoid, the test may be positive up to 3 or 4 months, because the test is based upon the immunoglobulins present inside our body. So you need not to be panicked that my test is again positive, what should I do? Oh my god, I'm still suffering from typhoid or not. Let the doctor to decide it. And sometimes the typhoid is also asymptomatic. It means that if you are suffering from, you may infected by the Salmonella typhi, but you don't have any kind of symptoms. So you need not to be panicked. If you find this kind of system, then you should consult your doctor. Most of the people say that typhoid is fatal, but I don't think that it is fatal, because if you arrive at the doctor, if you consult your doctor at that time, then it may, sometimes surgery, the doctor can also prescribe surgery in severe cases. Maybe if he will find any blockage in the intestine, then he will go for the surgery. Overall, it is not so dangerous disease. If you go to the doctor, if you maintain your personal hygiene, if you don't drink the contaminated food or water, then you can have the low risk. So if you find this video useful, then you can share your knowledge in your society. The only purpose to make this video to make the society healthy. So thank you for watching this video, and I will come again with this one of disease.